Join us. Good afternoon, and thank you for joining us today in this third image challenge live stream event from Retina Physician. My name is Mari Rodriguez, and I will be your host today. I am a retina specialist with Vitreoretinal Associates, and I practice in Massachusetts. I have no financial disclosures. As you know, we post an image challenge each month, and then we discuss the diagnosis and management using this platform. We would love to hear your thoughts online, and you can find us on Facebook, LinkedIn, YouTube, and Twitter. You're also welcome to write on the chat and share your thoughts with us during this event. Today, we will be discussing a case that I never saw during training. However, patients like this one are becoming more and more common, and we all can expect to see more of these patients. This 71-year-old lady with a history of metastatic melanoma presented to our clinic with photopsias for 3 days. She had blue-hued vision and things did not look right, according to her. She was 20/20 on presentation. She had normal intraocular pressures. The anterior segment examination was positive for 1+ nuclear sclerosis, but otherwise it was unremarkable. On posterior segment exam, she had a mildly blunted fovea reflex, and we could detect maybe a little bit of subretinal fluid on exam, but otherwise things appeared normal. There was no AC or vitreous cell. There was no vascular sheathing. On OCT, however, she had multiple pockets of subretinal fluid scattered throughout the macula. An FA was attempted, but as the patient started feeling nauseous when we were trying to get access for the fluorescein injection, the procedure was then aborted. So there was one key part of the history that I intentionally withheld from the post, and it was that this patient was recently started on a new medication, encorafenib/bimneltimab, to treat her metastatic disease. This is a combination of BRAF MEK inhibitors, which are part of the MAP kinase pathway. This pathway involves a series of activating protein kinases, including MEK and BRAF, which can influence gene transcription and cell proliferation. These inhibitors have revolutionized the management of multiple cancers, including melanoma, and the prevalence with which their use, as you can imagine, is increasing. According to the Columbus study in 2019, MEK inhibitors have been associated with serous retinopathy in about 20% of patients taking this medication. Now, going back to our patient, if we can put the second image up. So we decided to observe her closely, and since her findings and symptoms were mild, we did not recommend that this life-saving treatment was stopped. Slowly, her symptoms improved, and over several weeks to months, the serous retinopathy, as you can see, improved without intervention. When reviewing the literature on MEK inhibitor-associated retinopathy, others have also shown that the toxicity is transitory and it does not lead to irreversible loss of vision. In one study by the Yanuzzi group in 2018 in ophthalmology, the median time to resolution of the subretinal fluid on OCT was about 32 days, so about a month. In this study of 50 eyes, the fluid was self-limiting and it did not require discontinuation of the drug. So, in conclusion, as the use of MEK inhibitors is more prevalent, we as retina specialists need to familiarize ourselves with the toxicities of these medications. Thankfully, in this case, the maculopathy tends to be self-limiting. Close observation of these patients is key. Someone in the chat asked us if the diagnosis for this condition could be central serous retinopathy. And yes, there's some commonalities between central serous and MEK inhibitor-associated retinopathy. The things that are different is that the subretinal fluid and the MEK inhibitor-associated retinopathy tends to be multifocal, and it's bilateral. But both of them, I guess, are self-limiting. So thank you again for tuning in today. And again, you can leave us a comment online via multiple platforms. And we hope to see you again in another month as we discuss another interesting case.